The World Health Organization announced on Tuesday that COVID-19 could be more deadly than previously thought.
The WHO reported the disease's global mortality rate as 3.4%, higher than the earlier estimate of 2%. New data also shows that the coronavirus is 8 times more lethal for people with diabetes.
Instead of a handshake, try a footshake, a safer alternative amid COVID-19. As the disease spreads across the world, epidemic prevention measures are proliferating. A WHO director has endorsed a range of creative handshake alternatives, including waving or bumping elbows. France's health minister calls on its citizens to avoid close contact and to stop cheek kissing others as a greeting.
A cough, a sneeze, a handshake could cause an exposure.
The NBA has sent a memo advising players to avoid high fives with fans and to not borrow items like pens when signing autographs. Keeping a distance and staying safe has become a mantra repeated by many countries' governments. A new report from the WHO says COVID-19 could be more lethal than previously thought. With a death rate of 3.4% worldwide, the disease is 30 times higher than for seasonal flu.
COVID-19 causes more severe disease than seasonal influenza.
新冠肺炎比流感的重症率跟致死率高，这个大概目前是相信的了哈。
COVID-19 severity rate and death rate are higher than the seasonal flus. That's the current belief. But a question mark still hangs over whether COVID-19's death rate is 3%, because that 3% doesn't take into account many people with mild symptoms or no symptoms at all. If you factor all those in, it probably wouldn't reach 3%.
The health expert says COVID-19's actual mortality rate may not be so high. Meanwhile, February data on China's 70,000 COVID-19 patients shows that 10% of the people with pre-existing heart and circulatory conditions died from the disease. People with diabetes had the second highest death rate of 7.3%. That's 8.11 times higher than the rate for people with no pre-existing conditions.
糖尿病患者是处于一种免疫不好的状态，因为他们血糖太高了。
People with diabetes tend to not have a good immune system. The blood sugar is too high and they don't have a strong immune response. Actually, they have to be careful with any kind of infection. If they get any infection, their death rate is 2 to 3 times higher than for others. Reports in other countries indicate that for diabetics, the COVID-19 mortality rate can be 7 or 8 times higher. That's not beyond the realm of possibility.
Health experts say that vulnerable groups like the elderly or people with heart conditions should pay special attention to protecting themselves against infection.